Welcome to the module on routes of administration of drugs. The objectives are: learner will be able to understand drugs, their nature and resources, to know routes of administration of drugs, and to analyze a choice of route depending upon both convenience and necessity. Pharmaceutical chemistry is a study of physical and chemical properties of drugs, their preparation, structure, behavior, influence on an organism, conditions of their storage, and therapeutic uses of drugs. The term drug is derived from French word drago, meaning dry herb. It is defined as any substance used for purpose of diagnosis, prevention, relief, or cure of a disease in man or animal. According to WHO, a drug is any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. Nature and sources of drugs are classified as natural or synthetic, and drugs are derived from plants or synthetic or from animals, minerals, microorganisms, or it can be created by genetic engineering. Now, let us know the routes of administration of drugs. Based on the mode of application through the body, they are classified into a number of routes. And based on the type of the drug that is administered, for example, tablets, capsules, whether it is a dry powder or a solution or suspension, they are also classified into a number of routes. In the present video, let us understand the routes of drug administration through eternal, parenteral, topical, and inhalation. Oral or eternal route. These drugs are administered by mouth to the patients. They are most convenient for access to systematic circulation. Rectal route. These drugs are administered through the anal portal into rectum or lower intestine. Rectal suppositories or retention enema are administered in this way, especially in pediatrics and generics. Parenteral route. Administrations other than alimentary tract are called as parenteral route, and they are applied in vomiting, diarrhea, etc., which might irritate the stomach or when the patient is unconscious. Parenteral route are classified as intravenous, intramuscular, and subcutaneous mode of application. Based on the depth of application and the angle at which the injection is inserted, they are classified as intravenous, intramuscular, and subcutaneous route. Based on types of injection, let us understand intravenous route. They are administered directly into vein to give rapid action. Preferred when an emergency calls for an immediate response. Sometimes, due to rapidity with which a drug enters circulation, dangerous side effects may occur, such as depression of cardiovascular function, which is often called as drug shock. Intramuscular. Soluble substances, mild irritants, suspensions, and colloids can be injected through intramuscular injections, used where an immediate effect is not required but prompt effect is desirable. Sometimes irritation around the injection site occurs. Depending upon drug and other ingredients, these injections should be administered under medical supervision and sterilization. Subcutaneous. These drugs are injected into the alveolar connective tissue just below the skin. The absorption is slower than the intramuscular route, and it is used for those drugs which are desired to spread action slowly and for long duration. Example, insulin and sodium heparin, neither of which is absorbed orally and should be absorbed slowly over many hours, are administered subcutaneously. Drugs used in treatment of asthma, epinephrine, are usually subcutaneous to avoid the dangers of rapid absorption and other dangerous side effects like cardiovascular effect. Inhalation route. This route is employed for delivering gaseous or volatile substances to the systemic circulation. Example, general anesthetics. Absorption is very rapid as the drugs can be delivered into the alveoli of lungs having permeable epithelial membranes. Topical route. This method is employed to deliver a drug to a particular area, and it is effective only to areas it is applied. Large number of topical medicaments are applied to skin through topical drugs are also applied to eyes, nose and throats. In man, cutaneous absorption mainly occurs from surface. It can also be absorbed through hair follicles, sweat and sebaceous glands. When medicament is rubbed vigorously, absorption through hair follicles and glands increases. Since much of drugs that is absorbed through epidermis diffuses into circulation with reaching a high concentration in some portions of dermis, hence systemic administration of drugs should be given along with the topical administration. Sublingual route. These routes are employed when only a small amount of drug are required to gain access to blood. Patients with angel pectoris may get quite prompt relief from an acute attack by sublingual administration of nitroglycerin. We have come to the end of the tutorial. So let us summarize. Through this video, we have learned about drugs, their definition, natural and resources, various routes of administration of drugs like oral, rectal, parenteral, inhalation, sublingual and topical. We are able to analyze the choice of route depending upon both convenience and necessity. Are you ready to test yourself? Here are few questions to test your knowledge about the routes of administration of drugs. Are you ready with the answer? Here are the answers. Yes, you are correct. Resources. A textbook of pharmaceutical chemistry and fundamental concept of applied chemistry written by Jayashree Ghosh has been referred for making this video. Thank you and happy learning.